My name is Asom Tashimizi. As if March this year is exceptionally set aside for women. I mean, we started with Women's Day celebration on the 8th of March and we'll be ending with Mother's Day celebration coming up on 30th of March. And I tell you, I've been taking in all of the energy that I am grateful for all of the love, all of the care that we've received this month as women. But trust me, it's exceptionally important that you love yourself. And in what better way could we achieve this if you are not of sound health of mind and body? Okay, so as a gift, I want to tell you what I did for myself to celebrate Women's Day on the 8th of March. Even if you're not a woman, just stay with me to the end of this video because this concerns all. I mean, it has to do with our health. True joy stems from truly being healthy. So I never knew about this until recently, and that is about PID, Pelvic Inflammatory disease. So on the 8th of March, for Women's Day, I went to the hospital to have myself checked. This is as a result of information I came across recently on a sensitization video I saw, I think on Facebook, by Elite Engage or Elite Care Foundation Hospital. I never knew there was something called PID. I know there are a series of tests that women are expected to run at least each year or from time to time. For example, having your pap smeared to check for chances of cervical cancer. Number of diagnoses we are expected to run from time to time. Okay, so pelvic inflammatory disease is a destroyer because it targets the female reproductive organ. I'm bringing this information to you because I know that, like me, number of persons wouldn't also know about this, and given that it may not show you any signs. Some persons do have symptoms, and I will get to that. So let us just hit straight to what PID could do to the female body. And like I said, you may have no symptoms at all. Inflamed ovaries, inflamed tissues, and it could get so chronic that you may have pockets of fluid, like you may have abscess, you may have actual pus coming out from the female reproductive organ. Some people have this thing as one of the symptoms. You may have yellowish discharge, not knowing that it is pus coming out from your body. There could be fluid in your pouch of Douglas. By the way, until now, I never knew there was something called pouch of Douglas. Please let me know in the comment section if you know about the pouch of Douglas in the human body. So you may have pus coming out from your body as a result of pockets of infected fluid. Some of the symptoms that people have, that people experience and may not even associate it with PID because they do not know. Some people experience burning sensation in the pelvic area. You may have chronic pelvic pain that you cannot trace back to anything because you do not know that you have PID. Okay, some people experience painful urination ranging from mild to severe. Some people experience unusual or very heavy vaginal discharge. Please don't brush these symptoms aside. And this discharge may have a very unpleasant smell, like it has this odor. Some other persons might experience pain or even bleeding during sexual intercourse. Some might even have fever or chills for no reason, like they can't just trace where it's coming from. PID is majorly the cause of ectopic pregnancies. Did you hear? And if you know what ectopic pregnancy is, you know that it's a very life-threatening event that requires emergency medical attention. You don't want to go through that, trust me. These are some of the symptoms. Now, why is it so important that you go and have this checked? Its main damage to the female body is cases of infertility, but it does not stop there. You could be young, looking healthy, and then you get married and the babies are not just coming. And the tricky thing here is that it's not for people of any particular age. In fact, studies have shown that people who are even under the age of 25 are more susceptible, are even more prone to contracting PID. Now, another tricky point to know is that you may have even had one child or even finished having kids and still contract PID. If this is the case, that means almost 7 out of 10 women could have PID. And there's an estimation that by the year 2030, there will be increased level of IVF because more people will find it difficult to conceive. Trust me, I never knew that this is a thing. I am a mother of one. I am not actively trying to conceive, but when I came across this information, I deemed it fit to go immediately to go and check to make sure that everything is fine. if in future, by the grace of God, I try to have another baby, I will know that I've done everything on my own part. How does this concern me as a person? Hear me. PID is not only for those who have not had kids. You may have even finished with having your babies and still contract PID. That will be jeopardizing with your health. That is why it concerns every female, and of course the male too, but I will get to that. How could one possibly get PID? I'll talk about the major way of getting it and then other ways, okay? So majorly, PID is sexually transmitted. It's an STI. So if you are sexually active, you are at the risk of PID. Even if you are currently abstaining, you may have had PID from previous encounters and not know about it. You may be married and still be at the risk of PID because you have a partner who has this infection, or a partner who is not faithful to you, who has other partners from which he could contract it from and bring it home to you. This is why it's a wake-up call for everybody female to please go and check. Then the other ways you could get PID, which is rare or less common, is when bacteria enters into your reproductive tract. Anytime the normal barrier created by the cervix is disturbed. This could be during menstruation, childbirth, miscarriages, even abortion. So rarely, bacteria could enter into your reproductive tract anytime during the insertion of an intrauterine device, the IUD contraceptive. When I got to the hospital, I had to ask the doctor if this infection does not affect the men. And he made me to understand that even the guys are not safe because this infection destroys their sperm cells. You could be the reason for infertility in your marriage and you are not even aware of it. So please do well to go have yourself checked and treated if there's anything of sort. Let us help cope the troubles and traumas that people go through due to infertility. Do your own part. But we understand that it is God who gives the blessing of procreation, but it is this same God blessed us with the gift of doctors and the blessing of medical practice. So what can you do to stay clear of PID? If you've ever been sexually active, go have yourself checked. And if you are confirmed clean, please do well to abstain if you can. It is highly recommended to save yourself the stress and the money involved. Please do well to go to the hospital to check, because this is not a test you could carry out at home, because some persons have symptoms and some others do not. Samples need to be collected from you to run diagnosis to confirm if you have it and at the level it is at. Some people have abscess that gets so bad that the pus needs to be extracted, like sucked out from their system. Please go today and check and try to follow these sensitization videos, or just Google it. Like, until now, I didn't know there was so much information on it. I never knew there was something called PID. Okay, so I would advise that you go to a hospital where you are comfortable, where you could ask questions, because that is what I did. I try not to consult with the doctor where I'll have reservations. I like to ask my questions because I agree that you know better than I do in this field. Try to make sure that this is a doctor that knows what he or she is doing. I will feel free to ask questions without having any reservations at all. In fact, when I went to this hospital, the energy of the medical lab person who was supposed to collect samples and mine were not in sync at all. And I was able to tell the doctor, please, I'm not sure I want this person because it's as though there's some friction going on here. And he understood with me, and I had another person attend to me. Finally, we went to a hospital where there's nobody to talk to and nobody cares. So some of the things you may encounter during could be like the blood sample collection, urine, and then there's an insertion of finger to get samples from the girl down there. They'll also use a swab stick to get samples, and might also use a speculum to get samples from the girl down from your vagina. There's no shame in trying to attend health. Go get yourself checked. Always choose health over every other thing. So dear ladies and the gentlemen in the house, what will you be doing for yourself, or what will you be doing for the woman in your life this month to celebrate Women's Day and Mothers, or should we just call it the Women's Month? So apart from the material things that you bring to us which we love, or will you be like me, who will first go check that everything inside of me is okay first of all? Okay, until I come your way next time, please stay healthy, stay happy, and I'm rooting for you. Bye.